This is Clint and Katie and Annette and Ruth and Larry.
Picture an extremely active 9-year-old boy that loves all things sports, being outside, and participating in his school's jogging club. Suddenly, no matter how hard he tries to hide it, his pain becomes agonizing and he misses a lot of his favorite activities. No rhyme or reason, no apparent accident or injury, only horrific pain in his ankles, hands, hips, and neck. His emotions are high as he wishes so badly to participate in his favorite pastimes and baseball games. He often finds himself sitting the bench instead of playing the field. Multiple doctor's visits, x-rays, MRIs, and bone scans give no definite answers. Then what is believed to be a ganglion cyst lands this child in an orthopedic, only to find out it is not ganglion. Blood work is ordered, and the results send this child to yet another doctor, a rheumatologist. Finally, answers are given to explain this child's painful year. Being the mother of that 9-year-old boy recently diagnosed with polyarticular juvenile idiopathic arthritis, I find myself researching this disease quite often. According to Leslie Abramson, MD, with the American College of Rheumatology, my son is the 1 in 1,000 children that develops juvenile arthritis, and only one of about 300,000 total children that have been diagnosed. By the time his was diagnosed, he had already lost a great deal of motion in multiple joints, specifically his wrists, ankles, and neck. My research is so I can better help him and our family understand the limitations and treatments. Because his pains were undiagnosed for a year, I would like to convey my experiences and research to help others understand the effects, limitations, and treatment of this painful childhood disease. First, let's look at the meaning of polyarticular juvenile idiopathic arthritis, also known as JIA. Polyarticular means more than 5 joints. Juvenile, of course, means child. Idiopathic means there is no cause or reason for the condition other than the own body's immune system attacking its own tissues. Arthritis refers to inflammation and pain of the joints. Basically, for no apparent reason, this specific disease is caused by the child's own autoimmune system attacking 5 or more joints and destroying the tissue, causing great pain and inflammation. This can cause even the most active child to experience so much pain that normal daily tasks or even hobbies become unbearable. It can also cause unexplained fatigue, decreased appetite, and weight loss. JIA can also cause inflammation in the eyes known as uveitis, which can show no symptoms, but if goes untreated, can cause blindness. JIA can also lead to many emotional distresses, from sadness to anger, especially in an older child recently diagnosed. According to the Arthritis Foundation, the nation's leading research center for all forms of arthritis, this disease not only can have emotional effects on the child diagnosed, but also on the family caring for the child. Parents will go through many of the same emotions as the child while trying to help their loved one cope and understand and care for them during the course of the disease. As if these effects weren't enough, they can lead to more serious injury and limitations. When pain from flare-ups occur, difficulty with ordinary movements and daily tasks occur. The child can experience so much pain that it is often difficult to walk or dress themselves. Without proper treatment, further joint damage can occur and result in loss of range of motion, making task and playtime more difficult. Their flexibility also becomes hindered. If the eyes become affected and undetected, blindness can occur. All of these add to the emotional stress of the disease. Although the effects and limitations they cause can be devastating, with proper treatment, most children live fully active and normal lives. Although there is no cure for juvenile idiopathic arthritis, there are treatment options. The most important is to keep regular follow-ups with the child's pediatrician, rheumatologist, and ophthalmologist. These specialists must work closely together. Also, physical therapy can be ordered. The most common course of medication includes NSAIDs, and disease-modifying drugs. The most common of these are naproxen and methotrexate. According to the Symposium on Rheumatology in Adolescents, published in the British Journal of Hospital Medicine, the research and studies have proven that even though these medicines used for treatment can have severe side effects, such as liver disease, early treatment with them greatly reduces the risk of needed joint replacement. In conclusion, although juvenile idiopathic arthritis can be an extremely painful, debilitating disease for any child, there is a chance for the child to lead a fully active and normal life. Although there is not a cure for it, maybe by spreading the word and making more people aware of this condition, more children suffering can lead more active lives.